Hi, my name is Robin Lynch. I'm a registered dietitian nutritionist with Allied Digestive Health. I work at 3 practices within the organization: Shore Gastroenterology, Monmouth Gastroenterology, and Gastroenterologists of Ocean County. Today, I'm going to discuss just some questions that we have about IBS and nutrition, because that's a really hot topic, and frequently see patients daily who are suffering from IBS and nutritional concerns. So our first question was, what are some of the common misconceptions or misleading advice that people with IBS might encounter online, and how they distinguish between reliable and unreliable sources? This is a really great question, because so many of our patients come in and they get so confused with the conflicting information on the internet. You go in and you're asking Dr. Google and it says you can eat this or not eat that. And so it's really, when they come in to see me, a registered dietitian, I like to clear up all that kind of diet noise. I'm certified to teach the low FODMAP diet through Monash University, so I always recommend Monash as being our leading source, as they do a lot of the research and they test all foods. They have a very reliable application that people can test foods on. But even with that, I have people who have uploaded the app and they've went online and they are still very confused about actually how to implement the diet. And that's one of the biggest misconceptions. So I know that a person is probably not reliably implemented the low FODMAP diet when they come into me and they say, the low FODMAP diet hasn't worked for me because I've been on it for 6 months and nothing's changed. That's the first indication that they probably didn't do it correctly, because the diet is not designed for 6 months. There's 3 phases in the diet, and I think that's where the most biggest misconception is. First phase is an elimination phase, and that can last anywhere between 2 to 6 weeks. Usually my patients are usually done with it after 3. And then we go into the challenge phase, which is the most important phase, where we're actually introducing those foods and seeing which categories of the FODMAPs are the triggers and in what portion. And that's the biggest misconception too, is it's not just that food, it's the category of FODMAP that food contains and the portion of it. So those are definitely the most biggest misconceptions that I come across, is that people are implementing the low FODMAP diet incorrectly. And that's why I always recommend patients coming and seeing a registered dietitian who's certified to educate them on the low FODMAP diet, so they can have the best experience and try to figure out how we can help their IBS symptoms.